Hi everyone, welcome back to Doodle Nurse. Let's talk about the Raas system, which is the Renin Angiotensin Aldosterone System. I always think about this as the body's emergency backup system for blood pressure and blood volume. It turns on when the body thinks we're running low. Short term, that's very helpful, but when Raas stays on too long, like in the heart failure, it's actually causing more problems. RAS activates when blood pressure drops, or when blood volume is low, or when the kidney sends low salt. This can happen with dehydration, bleeding, or heart failure. The kidneys basically think we don't have enough circulating volume, and so they trigger the RAS to compensate. So, the first step, it starts in the kidneys. When the kidney sends low perfusion, they release an enzyme called renin. So the renin's job is to kick off the whole RAS cascade. Then renin acts on angiotensinogen, which comes from the liver, and converts it into angiotensin 1. At this point, angiotensin 1 doesn't do much. It's really just setting the stage for what comes next. Angiotensin 1 then travels to the lungs where it meets the ACE. It's the angiotensin converting enzyme. ACE converts angiotensin 1 into angiotensin 2, which is the heavy hitter in the system. Angiotensin 2, then they do several important things all at once. It tightens blood vessels to raise the blood pressure. It triggers aldosterone release, which increases the antidiuretic hormone and makes you feel thirsty. All of these works together to raise your blood pressure and then the blood volume fast. Aldosterone acts on the kidneys and basically says, hold on to the sodium and water that get rid of potassium. So this increases blood volume, which helps in emergencies, but it also leads to fluid overload if RAS stays activated. In heart failure, cardiac output is low, so RAS stays turned on. So the body keeps thinking it needs more volume, even though the patient is already fluid overloaded. So this leads to swelling, weight gain, pulmonary congestion, and also worsening heart failure. This is why many heart failure medications target RAS, the ACE inhibitors, the ARBs, they block the angiotensin II and aldosterone antagonists, reducing fluid retention. These medications don't just treat symptoms, they also slow disease progression. We also have to remember about the diuretics that ends in ide, furosemide, furosemide, hydrochlorothiazide. It's important to educate patients to take their meds. So, as the review, when RAS is overactive, we'll see signs like peripheral edema, pulmonary edema, rapid weight gain, high blood pressure, and sometimes ascites in advanced cases. These symptoms are driven by fluid retention. But here's the big picture. RAS is meant to protect us when blood pressure is low, but when it stays on too long, makes things worse. So understanding RAS helps explain heart failure symptoms and why certain medications are so important. For nursing focus, so why RAS matters in nursing? RAS regulates blood pressure, fluid balance, and perfusion. It becomes especially important in heart failure, hypertension, kidney disease, shock or decreased renal perfusion, and the fluid volume imbalance. On the assessment priorities, Vital signs, especially the blood pressure trends, the heart rate, orthostatic changes. Also for the fluid status, the edema, weight gain, intake and output. Also the respiratory status, crackles, and risk for fluid retention. Remember, RAS activation is equal to vasoconstriction, so it adds the sodium and water retention, and then it turns the blood pressure to go up. And so they have increased preload and increased workload on the heart. On the red flags, we have to educate them when to call the provider. New or worsening short of breath or edema. Rapid weight gain about 2 to 3 pounds in a day or 5 in a week. Also, always monitor with the urine output. It could become dark if they are severe hypotensive and having any dizziness or syncope. Another patient education points is to let them know to take their blood pressure medications every day, not to skip those doses. Also, rise slowly, especially when waking up in the morning or after naps to prevent dizziness. And they have to monitor daily weights at the same time each day just to look at the trends. Also, limit the high sodium foods in their diet because that causes the fluid retention. And they have to monitor muscle weakness, palpitation, or any additional swelling. Also, to inform them to avoid NSAIDs unless approved by their providers. Also, for students, a simple memory cue. RAS equals raise and add stop. So that means raise the blood pressure equals the vasoconstriction. It also adds the fluid and sodium and sometimes adds potassium problems. All right. Thanks for watching the Doodle Nurse. Have a good one.